Saw. So with that, I'm going to turn it over to Ohio State to start us off. So guys, the Zoom is all yours.
Hi, I'm Dr. Sheetal Bavishi. I'm the program director for Ohio State University. And we have on the drive a PowerPoint presentation as well as some information about our program. So I will actually turn it over to our chief resident, Dr. Stephen Anderson. He'll be giving a presentation, and then we'll be doing a question and answer session with a couple of our residents that are on as well. We have a PGY2, PGY3, and a PGY4 on.
All right, so I'm Stephen Anderson. We have a couple other residents. I'm the PGY4 at Ohio State, Chief of Recruitment. We have one of our PGY2s, Carter Newway, on here with us, two of our PGY3s, Alex Heck and Daniela Iliescu, and one of our other chief residents, Andrea Dockery, who's on here as well. So I'm going to host his disabled participant screen sharing. Am I able to share the PowerPoint?
Yeah, you are. Sorry, give us 1 second. We'll go ahead and allow everyone to screen share.
Awesome, thank you.
In the meantime, we can introduce a little bit about ourselves. So I've been at Ohio State University since 2013. I took over the program directorship in March of 2019. Prior to that, I was the associate program director starting in October of 2018. So part of our presentation also talks about the diversity in our program. So one of the things that we're pretty proud of is our diversity. We have 20% of our residents are minority, and then 83% of our faculty leadership is female. So I'm not sure if you can share your screen yet.
Yeah, Dr. Anderson, go ahead and try.
Perfect.
Okay.
Perfect.
There you go.
Sorry about that.
That's
All
okay.
right,
Is it
perfect.
working? Can you hear me?
Yes.
Yep, you're good.
All right, so we are the Ohio State University Wexner Medical Center Physical Medicine and Rehabilitation Program. We were founded in the 60s, 1963, by Ernest Johnson, who I think is a big name in PM&R, and we're, consistently a top-ranked program, and have a lot to offer. And so we're going to kind of focus on that, focus more on the rotations and the different opportunities that you'll have here at Ohio State. So kind of an overview of the program. The primary rotations for your inpatient rehabilitation experience occurs at Dodd Rehabilitation Hospital. It's a 60-bed inpatient rehab unit. We also have a 12-bed inpatient rehab unit at Nationwide Children's, and I'll talk about that in a little bit. We take 7 residents per year. There are 3 categorical positions and 4 advanced positions for a total of 24 residents at a time at Ohio State. If you interview here, you do not have to interview separately for the internal medicine program. That's just included in your interview with our department. We also have 32 PM&R faculty members, so a pretty big department. Your rotation schedule, kind of the breakdown looks like this. Your PGY2 year, you do a lot of inpatient rehab. We have specific rotations that are dedicated to each service being dedicated to specific things, sorry. So for example, we have a specific brain injury rehab rotation, a stroke rehab rotation, a general rehab rotation, and a pediatric rehab rotation. So you're immersed in the different area, traumatic brain injury or stroke. Your 3rd year, you have a cancer rehab, spinal cord injury rehab, and a senior service. So you're immersed in that specific service. You're learning everything that you need to know about traumatic brain injury, spinal cord injury, or stroke. Your senior service, your 3rd year, you kind of cross cover and help with overflow, help with admissions, and kind of do some more of the administrative stuff. So you learn that side of it too. At Nationwide Children's, again, we have a 12-bed inpatient rehab unit for the 2nd years, and they're able to work on that. And then also they have a pretty robust outpatient children's pediatrics rotation where they're able to work with our group over there, doing different things from myelo clinic to spasticity clinic and Botox, doing EMGs on kids. So quite a lot. And then you can tell on the green, you get a little bit of outpatient 2nd year, about half of it's outpatient 3rd year, and then it's all outpatient 4th year. And the call kind of reflects that. The call is all front loaded to your PGY2 year. PGY3 year is kind of split, and PGY4 there is no call, and it is home call. Our curriculum includes a variety of lectures, conferences, case conferences, journal clubs. We have a 12-month rotating didactic curriculum and a longitudinal musculoskeletal and ultrasound courses. Our courses focus on, the important PM&R things that you're going to get anywhere you go, but they do a really good job here focusing on neuro rehab, P&O, general rehab, neuromuscular, pain disability, MSK, sports, clinical ultrasound, peds, and cancer. All of our lectures are recorded, and so you're able to access those afterwards, and we post the PowerPoints online as well, so you're able to go back and review those. We also have the option for Zoom, and so you're able to call in and be able to participate. We're currently doing all of our lectures, as I'm sure most everyone else is, over Zoom or whatever other web-based program they're using. A lot of opportunities at Ohio State. So we have a pretty robust neuromodulation center from both kind of the invasive and non-invasive side of things. We are a TBI model systems and an SDI model systems, so we're both designated as both. We have a comprehensive spine center where we work closely from both an interventional and non-interventional based standpoint, and there are plenty of opportunities with that. We have a robust assistive technology center and adaptive sports in the Columbus area as well. If you're interested in sports medicine, besides the courses and the ultrasound courses, we do have a robust sports high school sideline coverage. So Ohio State has contracts with the Columbus City school districts, and you're able to participate in any sort of sport that you would want to cover, whether that's high school football, lacrosse, track and field. And so those opportunities are available for you, and they love having us out there. We have multiple clinic site locations, including the VA, Nationwide Children's, again, private hospital setting and academic hospital setting, and I'll point out some of these to you here in a minute. So this is the Ohio State University Wexner Medical Center campus, just different locations. Here on the top left, we have the James, that's the giant cancer center that we have here, the heart hospital, and then just the general medical center, as well as the Brain and Spine Institute that we have. And Nationwide Children, again, that's what we feel is one of our strengths, as well as having such a robust pediatric program, and our residents consistently rank that as one of the top rotations that they have. We also rotate at the private hospitals through Ohio Health, Grant Medical Center, and Riverside Methodist, where we do consults, and then we also do ultrasound and EMG. We are fortunate enough at this program to work with Dr. Jeff Strakowski, who's a real big name here in the United States and across the world in ultrasound and high frequency ultrasound and EMG. And we're able to work with him both our second and fourth years and get pretty good experience with him. Additionally, this picture on the bottom right is Mount Carmel system. We work with a group over there that serves as consultants for the inpatient rehab unit over there. And so we kind of see all sides of things, both the academic, the private, and then the consultant sides. So it gives you a really good inpatient experience. As far as the outpatient experience, again, we have all the bread and butter PM&R things. Again, we have a robust adaptive technology center at Martha Morehouse, the comprehensive spine center. If you're interested in interventional spine, MSK, or pain medicine, we work closely with those guys over there and are able to participate. And they're very hands-on and let you do what you want to do. And then the bottom two pictures are the Jamison Crane Sports Center and the Lewis Center Sports Center, where we work with Dr. Beria, who is one of our PM&R attendings. He's the director for the orthobiologic department here at Ohio State. And so you get a lot of exposure as well to, very cutting edge stuff with PRP, lipogems, and additional orthobiologics that they're working on. And they put out a lot of research that we're able to participate in. Additional fellowship opportunities that we have here. So you get exposure to all of these during your residency here at Ohio State. So interventional pain medicine through the Department of Anesthesia, pediatric PM&R at Nationwide Children's. There are 2 non-PM&R sports medicine fellowships here in Columbus at Ohio State, Grant Medical Center, and then additionally there's a third one at Nationwide Children's Hospital if you're interested in pediatric sports. And then there's a neuromuscular fellowship through the Department of Neurology, and we work closely with one of the attendings over there, Dr. Arnold, who's PM&R trained, who did the fellowship, and so we're able to do electrodiagnostics and additional workup with him over there. And then we have 2 non-accredited fellowships here at Ohio State through our department, a cancer rehabilitation fellowship, and then a neuromodulation fellowship as well. So Dr. Bavishi talked about the diversity of our program. That's very important to us here at Ohio State as well. So, and then this is our contact information. So again, Dr. Bavishi is our residency director. Stephanie McDonough is our program coordinator, and her contact information is there, as well as her phone number. And I'm the recruitment chief. And if you have any questions, please feel free to shoot us an email or give Stephanie a call. We'll get back to you. And if you want any additional information, our website's listed down here on the bottom. So that's it for the presentation. With that, we'll go ahead and open up for question and answer, and the other residents are on the line and they're available to answer those questions as well.
You can also post questions on the chat, so I'll be monitoring those as well if you don't want to unmute for your questions. And we'll get started with those if anyone wants to start. Otherwise, we can have our residents tell you a little bit more about themselves and why they chose the program. Okay, well, Dr. Anderson, I'll let you get started.
I'll kick off. So one of the things that drew me to the program, the call schedule. So one of the things that drew me to the program was just kind of the breadth of experience that we get, and that when you're on the rotation, that you're focused on that rotation and are really get that experience to learn it really well. The call schedule, yeah, so it's home call when you're on the inpatient rotation. So your PGY 2-year, you'd have, I think it's a total of 24 weeks of call. So it's 24 weekdays throughout that period. It's 1 day a week, and then you'd have a couple weekends throughout there. And then at Children's, you alternate call with the senior. And so again, that's front loaded to be your PGY 2-year. PGY 3, it's less, and then PGY 4, there is no call, so no call as a senior. And then there's a question, can you discuss your wellness initiatives? Does anybody else want to answer that, or I can jump on that?
Yep, I'm Daniela, I can take that on.
Okay.
So for our wellness initiative, we have a specific structured wellness mentorship program that we started recently. We have each PGY2 being paired with a PGY3 in order for them to have direct resources right when they start the program. Kind of your typical questions of when you move into a new city, what to expect from each rotation, things like that. Then we have mentorship groups that are made out of a few PGY4s, PGY3s, and PGY2s. And they meet once every 2 months in an informal manner. Unfortunately, now it's mainly on Zoom to keep it safe. But that's an opportunity to be able to talk across the board and have kind of feel like you have a family and be able to ask PGY4s what they're doing about matching into their fellowship and have kind of more of a direct contact to any questions you might have. And you have all the residents there. So this is mainly meant to, again, give a feel of a family in a program that's more of a medium-sized. So if there's any residents that you normally wouldn't interact with as much, you have that opportunity. In addition, our inpatient months are very bonding and are kind of creates the base of our family. You are there with 6 residents kind of in the same big workspace, and you work together your 2nd and 3rd years, and that allows you to kind of form that camaraderie. And overall, all of these kind of set the theme for a very collaborative residency, and keeps us happy, keeps us sane, and keeps us working hard and doing the best for our patients while having the support of the other colleagues.
So in addition to that, we also have faculty mentorship. Each of our residents is paired with a faculty mentor in the area of their interests. So usually by the middle of your 2nd year, you're paired with your mentor. One of our faculty is in charge of our mentorship program. He surveys the residents with their interests, and then also has surveys of all the faculty with what their focus is, and then he pairs them accordingly. And so we're trying to help both the faculty and the resident have a good mentorship program. Some of the other questions that were on here, I'll kind of link them together. I think the ultrasound EMG procedures, we can all kind of put those together. So during your outpatient rotations, both PGY 2, 3, and 4, as well as during your consult months with Ohio Health, you will actually do EMGs. So we have, and then we also have EMGs that we do in the prison system as well. None of our residents have a trouble meeting their 200 EMG requirements. Majority of our residents graduated with over 250 EMGs that they have to do. From the ultrasound standpoint, like Dr. Anderson said, you know, Dr. Strakowski is well known across the world for ultrasonography, and so we're very lucky to have him on faculty. We have a robust musculoskeletal ultrasounds curriculum. We have 10 ultrasound sessions per year where we kind of break down each of the different locations under ultrasound, and we work with about 4 or 5 of our faculty who are trained and certified in ultrasound. Anatomy-wise, our sports and MSK curriculum is very robust as well. That's our longitudinal curriculum. We have cadaver injection labs that we do once a year where the residents go into cadavers, and they're not prosected cadavers. They're actually whole cadavers to learn how to use the ultrasound guide and the guided injections as well. So procedures-wise, we all of our residents are one-on-one with their attending, so none of them have a difficulty with obtaining any of the procedures that they need for the requirements. And then it looks like some of the other questions about research. So Daniela is actually our residency research committee or coordinator, so she can talk a little bit more about that. But we do have monthly research meetings. We have the TBI and SCI model systems, so our residents can get involved in both of those from a research.
You guys have 5 minutes.
So the research requirements for our residency is a quality improvement project, as well as presenting at a national meeting. So we fund our residents to go to national meetings if they get a poster or abstract submitted or they have a national presentation. So traditionally over the last couple of years, we've had at least 11 to 12 residents per national conference, AAP, AAPM&R, being able to attend and present. Other questions, I think, were sports coverage and community outreach. So Daniela, do you want to talk about the adaptive sports community outreach that you do?
Yes, definitely. Well, first to address the research really quick, because we have such a big department and so many specialized attendings, any kind of research idea you have or interest you have or research project, you will be able to find a mentor. Our faculty is very involved in research and very happy to help with anything you want to do. So you can be as involved as you want to be in research. In terms of community outreach, we have Columbus has one of the biggest number of adaptive sports available. We have almost 20, from sled hockey to wheelchair basketball to adaptive climbing, and really anything you can think of we have here. Any resident is happy to get involved and available. Any opportunity, the same. We have practice, we're invited to go to practice, spend time with our patients that way, and a lot of opportunity also for research and involvement there.
And then with our chronic brain injury discovery themes, we also have, you know, a lot of activities for TBI Awareness Month and brain injury awareness. So, and National Brain Injury Association of Ohio. So there's a lot of outreach opportunities. And then global health opportunities are available at Ohio State. We have a whole global health department that helps set up any global health rotations or opportunities that the residents may want. And, you know, usually we recommend setting those up at least 6 months to 9 months ahead of when you're going to go. So that way everything can be taken care of, but there's a lot of those. And there's free clinics and other things that are not PM&R based or general medicine based, but that are available to all of our residents. And it looks like one last question on how to evaluate the applicants and what do you look for in their applications. I guess it's directed towards me. And the main thing that we look for is well-rounded individuals. We want people that have had unique and diverse opportunity, experiences, but also, you know, the research-based, the leadership-based. We are a program that likes to develop leaders. So, all right, looks like we're over.
Oh, no, you guys still have 2 minutes.
Oh, we have 2 minutes. Oh, okay.
Yep.
And so leadership, research, and then of course, you know, a variety of experiences. So the PowerPoint that is on our drive also has things about board scores and other things. So I'll let Carter or Andrea or any of the residents, if they want to answer any questions that may be out there that you have more information that you would like.
Hey guys, it's Carter. I just wanted to say real quick, I'm a PGY2 here, so I just started, but it's been a great experience so far. And I think the biggest thing to look for with the program is just the right fit. So look at what you're looking to do as far as your career, what your interests are, and of course the location, the program itself. And I think you're all gonna find the right fit for you. And so feel free to reach out if you have any questions about Ohio State. I'm happy to be a resource for you. So.
Okay. And then I think one of the questions on research was, is it basic science, clinical, or a good mix of both? It's actually a good mix of both, where we do both basic science as well as clinical. There's a lot of opportunities with our neuromodulation. So someone asked about unique opportunities, and the Neuromodulation Center is one of the unique opportunities that we have. And we're the only neuromodulation fellowship for PM&R in the country.
If there's any last minute questions, we still have about 20 seconds left.
I'll add something at the end here. So we're a very hands-on program. So as much as you want to do as far as, you know, procedures you're able to do, if you're interested in interventional spine and pain, they very much let you get involved and do things. And obviously that's progressive as you go through the years, but they're very hands-on. Same thing with ultrasound injections, and then EMGs, you know, you jump in and you do those right off the bat. And again, you know, we train under people that have a lot of experience. Dr. Pease is one of the names that we still have, one of the attendings we still have here at Ohio State, and he's been doing this for, I don't even know how long, but he was a former president of AA&EM. So you're going to get really wonderful procedural experience here if that's something you're interested in.
Awesome. Ohio State, thank you guys so much for your time. Sorry for the initial tech issues, but thank you so much for your time and for the presentation. It was great.
Thank you.
Thank you.